You're watching iWitness, the Print's new live daily feature covering the COVID pandemic. We have the Print's reporters fanning across the country covering this horrific second wave. And today I'm joined with Moushumi Das Gupta, who is in Allahabad. You can see that that there is a railway bridge where she's standing. Moushumi, can you tell me where you are? I can also see some fumes at the background. It's a little bit far, but if you move your selfie stick a little bit more to your right, I just saw some fumes. So can you just tell us where you are? What's your location right now?
Hi Jyoti, I am right now at the Fafamau Ghat in Allahabad, where all the COVID dead bodies are being cremated. So the authorities here have basically allowed all these COVID dead bodies to be cremated in the Fafamau Ghat and not the main cremation ground in the city, which is at Rasulabad.
Okay, Moushumi, if you can just move your selfie stick a little bit towards your right, over your right shoulder. Yes, viewers, can you see just over Moushumi's right shoulder? You can see these plumes of smoke. It's a little bit far in the background, but I think you can spot them. And Moushumi, why are you so far away from the burning piles? Is it that you're not allowed to go closer? What's the reason?
Yeah, Jyoti, because the authorities have demarcated the areas where COVID dead bodies are being burnt, and I mean people are not allowed there unless and until the relatives of the dead. So they are not being allowed there.
Because we also want to be very, very sensitive towards our
Yes.
fellow citizens who have very, very, very unfortunately passed away from this horrific infection, from this pandemic. Moushumi, you said that in this ghat, this is the Papamau Ghat, and that the city authorities or the district authorities are allowing cremations here. What does that mean? Are you saying then that in the regular ghats where cremations are usually held, are those already overburdened?
They're not overburdened, Jyoti, but because the other cremation ground at the Rasulabad Ghat is a small one. So non-COVID bodies are being cremated there because you have all these protocols to follow when you are cremating a COVID dead body. So that's why this area has been opened up for that. As you can see, it's an open ground. I mean, it's basically, we can't see, the river has dried up here, the Ganges has dried up here, but it's an open ground with lot of space, lot of open space, so which has been allowed. And also, Jyoti, one has to remember, because there has been bodies coming in throughout the day. I was speaking to some of the locals here. They say that they haven't seen Fafamau Ghat. They don't remember seeing Fafamau Ghat like this. I mean, in a long time. I mean, the bodies are burning throughout the day for the last fortnight or so.
So what is the situation in Allahabad, Moushumi?
Jyoti, in Allahabad right now, yesterday, April 25th, Allahabad saw some 2,000 COVID cases in a single day, and there were 14 deaths. Overall, Jyoti, I mean, in UP, if we take UP as a whole, so the state is one of the, state has seen overall 35,000 cases yesterday, which is second highest in India, and 208 deaths. And in UP, Allahabad is among the second highest cities after Lucknow. Lucknow, the capital, of course, is exploding with COVID cases, exploding with the COVID deaths have spiked up. Lucknow has seen some 5,000 COVID cases yesterday, and there have been some 11 deaths yesterday. So Allahabad is just after Lucknow, is a second city in the state which has the highest number of COVID cases as well as COVID deaths. So and the numbers are increasing.
So viewers are sending in their questions, Moushumi, to you. And as they come in, I will be sending these questions to you. Where you are standing at this Papamau Ghat reminds me that in 2013, the Kumbh Mela was held here. And I was at the Kumbh that year, covering the Kumbh. And I remember thousands and thousands and thousands of people. And now to see it so barren and it's just completely so different. There you were celebrating life, and now we're mourning
This is going to be the most haunting image of this year, not only here, across states in India.
Right.
Bodies burning throughout the day.
So Mayank has a question for you, Moushumi. He wants to know, is the UP government under-reporting deaths?
UP government, of course, Jyoti, has been under-reporting deaths. I did a story from Gorakhpur, where, Gorakhpur's main cremation ground, the Rajghat cremation ground. So they have set up a desk there, municipal authorities have set up a desk there where one has to register when you bring in a COVID dead body. So on April 23rd, for instance, when I went to the Ghat, the cell there had registered 37 COVID bodies, which were bought for cremation. But when the official figures from the district administration came in the evening, they gave the official dead figures as just 5. And this has been happening day after day after day. The municipal authorities who are posted at the Ghat, they say that, they can't fudge figures because it's all there in the register.
Right.
And they are showing, the death figures every day since the last 1 week in double digits, 12, then 37, then 26. But the official figures that come from the district administration in the evening shows the death figure as just in single digits, 2 days, 3 days, 4 days. So in fact, I asked the Gorakhpur Divisional Commissioner, Mr. Jayant Nalikar, about this, that how does he explain this mismatch, this discrepancy?
Yeah.
And he told me that it's because bodies come from some 14 to 15 districts adjoining Gorakhpur to this ghat, because it's one of the biggest ghat there. So that's why, the numbers don't reflect in the official figures. But when I asked him that whether if somebody comes from adjoining district, say Basti, whether the municipal authorities there report those figures to the Basti authority so that it gets recorded somewhere. Mr. Nalikar said that he doesn't know about this. So nobody knows what is happening. But the fact remains that there has been massive underreporting of cases. For instance, Jyoti, we have been standing here in the Phaphamau Ghat since the last 1 hour. We counted some 10 bodies which have come in here. But official figures, we'll have to wait for the official figures in the evening. But I'm sure that the official figures won't reflect these numbers.
So explain to me, Moushumi, if say in Gorakhpur, if 37 people were died, for example, if they died in 1 day, and if the numbers are reflecting, say, 10 or 12 or 15, so then that's by 50% this is being underreported, right?
Yeah. So yeah, we don't have exact figures, Jyoti, because we are just going by the figures given to me by the municipal authorities there at the Rajghat, and
right.
And then we match it up with the official figures. But the fact also remains, Jyoti, that the municipal authorities there said that many people, Gorakhpur is a small city, and you have villages. There are small villages. Adjoining in the city. In Gorakhpur district and in the adjoining districts like Kushinagar and Deodia. So authorities said that many a times these villagers, they go and bury the body where they find space, near some canal, near some small, water body around in the vicinity. They don't come to the cremation ground. So those numbers anyway don't get reflected anywhere.
Right. So the several questions have come in, Moushumi, and Rohan is asking, with Yogi Adityanath, the Chief Minister, down with COVID, how does the UP government plan to tackle this crisis? And Jatin wants to know, is UP going to be like Delhi and Maharashtra, another terrible hotspot in our country?
Jyoti, we are already seeing some of those scenes in Lucknow right now, where hospitals are running out of beds, hospitals are running out of essential oxygen supply, the critical oxygen supply, essential medicines. But I traveled to Gorakhpur and now I am in Allahabad. Right now the situation in Gorakhpur is still manageable. In Allahabad, it's manageable. Doctors are saying time and again that the numbers are increasing, and if the numbers keep increasing like this, they would have a significant health infrastructure in this smaller tier 1, tier 2 cities. the kind of doctors or that kind of health facility there, leave alone the smaller towns in the center and the community health centers. There is nothing available there. Another reason also, Jyoti, is that testing
Moushumi, when you say nothing is
very
available, what
UP
does that
has a
mean?
population.
When you say nothing is
So
available,
Jyoti, I'll give you one example.
yeah.
So I'll give you one example, Jyoti. So yesterday we went to this block called Shankargarh. It's some 40 kilometers away from driving distance from Allahabad. It's a block. So in Shankargarh block, we have two primary health centers. So I visited one of the primary health centers. It's called the Lalapur Primary Health Center. It's in who visited this primary health center was some 6 months ago. So after he retired, no doctor has come to this primary health center, and it has just one ward boy and one pharmacist, and the ward boy runs the primary health center. So villagers there, if they fall sick, if they are serious, they don't have a choice but either to go to the community health center in Shankargarh, which is some 30-35 minutes driving distance away, or they go to Allahabad. And in a serious condition, I mean, many a time patient do die also by the time they reach the district hospital in Allahabad.
Right. So Purshat wants to know, Moushumi, that the Yogi government on Sunday announced that it will bear the cost of treatment of COVID patients, even in private hospitals. But will they also bear the cost of cremations? Are people even talking about these things?
Jyoti, cremation right now, Gorakhpur and Allahabad, it's the civic authorities. So, I mean, people don't have to pay anything. So, uh, of course, they have to come in their own PPE kits and stuff. And but like you, I don't know if you can see in the back, there hardly anybody who is wearing a PPE kit. I can see only a handful of people who are wearing
We
a
can't
face
see.
shield.
We
Of
can't
course, people are wearing masks.
Yeah, we can't see too
Can
well
you see?
because it's a little far.
Let me try moving it a bit. If you can, just let me know if you can.
No, just yeah, don't fall, Moushumi, because it's kind of uneven over there.
Yeah, can you see now?
We can see some people, but it's a bit far. But doesn't matter. Moushumi, tell us what
Okay.
you are seeing.
Hey, Jyoti, there are right now, I mean, I can see 4 bodies being burned here. There are people, family members there. I mean, majority of them are without a face shield, are without PPE kit. Uh, and, like there aren't any help desk that has been set up here or any civic authority
Yeah.
being followed or not. People, they are going through a lot of trauma when they bring near and dear ones, loved ones. So
What about travel restrictions, Moushumi? Rajan is asking, are there any travel restrictions within UP? Are people able to go, say, from or to go to
you no go Jyoti, there are no travel restrictions as such. UP lockdown only on during the weekend, Saturday, Sunday. But other than that, people can move around. But what I saw last 1 week of my travel from Lucknow to Gorakhpur to Allahabad is that people, people are adhering to, people are going for the self-imposed lockdowns. For instance, in Lucknow, the Hazratganj Market Association has gone into a self-imposed lockdown. They have shut their shops. They are, and they are keeping inside. Even in Gorakhpur, in the thoroughfare marketplaces, many of the shops are closed. So people are themselves, people are very scared. People are very apprehensive, and they are keeping indoors. But then, Jyoti, I mean, it's only in some of the areas in the marketplaces and all. Once you travel towards the interiors, towards the villages, you see villages. Nobody is wearing mask, social distancing, nobody has heard of, which is very scary, Jyoti, right? The COVID numbers for the first time is showing an increase in the rural area to urban areas.
The rural areas are showing an increase in the COVID numbers, Moushumi. Is that what you just said?
Yeah. So, for instance, in Gorakhpur, Jyoti, figures that were given to us. So, in the last 10 days, on 4 days, the COVID numbers outstrip the urban numbers, and which is a matter. Even the divisional commissioner in Gorakhpur said that it's a matter of concern. And one of the main reasons for that is that you don't have a health facility in the villages. The primary health centers are just there for the sake of being there. Neither you have doctors nor you have medicine. The community health centers also do not admit serious patients. If somebody is serious, diagnosed with COVID, who has tested positive and is serious, he is sent to the district hospital, which is in Gorakhpur. In case of Allahabad, it's Allahabad. So by the time, a patient reaches there, if he's in a very, very serious condition, there is no way that, he's going to get any help in the villages. So that's why it's a matter of concern. Even doctors are saying that, even the civic authorities admit that.
So then what about RT-PCR tests or rapid antigen tests? Are people even, are these being conducted even? And what are the figures?
Jyoti, Uttar Pradesh has over 1 crore population. So RT-PCR, roughly 0.1% of the population is being tested, which is like nothing.
Can you just repeat that?
And this includes both.
Because your voice was hanging. So can you just repeat what you just said, please?
Yeah. So Jyoti, UP's population is a little over 20 crore as per census 2011.
Yes.
So just about the administration is testing just about 0.1% of the population. Testing is barely, very minimal testing is. That's why, in fact, COVID cases, numbers of actual COVID cases in the state would be far such a low testing, then nobody. And also of the 0.1% testing, Jyoti, majority of that is rapid antigen test. RT-PCR test, again, is very less.
Right. Last couple of questions, Moushumi, but Mohit is asking, since there are many temple towns in UP, how is that likely to affect the numbers, considering many people are returning from the Kumbh Mela that was held in Haridwar? Are you seeing that the Kumbh returnees are being tested before they're being allowed to go back to their towns or villages?
There has been no screening centers. No screening centers have been set up now or in Gorakhpur or in Allahabad to test Kumbh returnees. In Gorakhpur, one of the family members, the head of the family, died 5 days after returning from Kumbh. He developed symptoms. He had fever. By the time he was rushed to the district hospital in Gorakhpur, the BRD hospital, it was too late. He collapsed before that. In Allahabad, one of the seers who had gone to the Kumbh died 2 days before, Jyoti. So, there is no data on how many people have returned from Kumbh. So if you don't even have the basic data, how are you going to go and screen them? And there has been no screening facility that has been set up also. When you talk to the authorities, they will tell you, yes, we are setting up, we are in the process of screening, but I didn't see any screening centers being set up anywhere to test the Kumbh returnees. Not only the Kumbh returnees, Jyoti, even the migrant workers who are now coming back in droves to different cities and towns of Allahabad, Allahabad as well as Gorakhpur, there is no center, no system in place to test them. No thermal scanning happening, no testing happening. But on papers, the state government has said that, migrant workers will be tested, and if they test positive, they would be quarantined or they would be sent to their home to quarantine for 14 days. But on the ground, nothing like that is happening.
So in Gorakhpur, Moushumi, there is a big mutt to which Yogi Adityanath belongs. In fact, he was the head of the mutt until he became chief minister. Now, did you go there and did you find that, was there any awareness of the COVID pandemic?
Jyoti, I was there on Saturday, Sunday, being a weekend, and also because there was lockdown. So the place was completely empty. Nobody was there. So, I mean, but by and large, Jyoti, even in the towns, I mean, the awareness is very limited. You only see when you go to the markets and all, you will see that 50% of the people are moving around without masks. People are gathering and gathering in large numbers in some places. So no social distancing
Why
is happening.
don't they understand that there is a pandemic? What is it? Is it a lack of communication that people don't know about it? Or is it that they feel that it's not going to come to them? कि मेरे को कुछ नहीं होने वाला है, बाकियों को अगर कुछ हो सकता है तो होगा. Is it that sort of a fatalist kind of a...
In the urban centers, Jyoti, there is a lack of you know outreach from the government also. I mean, at a time like this, I mean, they have just set up sound systems at all the chaurahas in Allahabad, for instance, where these sound systems keep blaring round the day that you need to follow adequate measures to, keep COVID away. You need to mask yourself. So that's the only thing, that's the only outreach that is happening right now. Other than that, there has been no communication from no awareness drive, IEC, information, education, communication setup of the government here in the towns. And when you go to the villages, so villagers don't care. They are like, corona varona kuch nahi hai, ye sab jo hai, ye sab shehron ka bimari hai. So that thing is there. We did come across people who are wearing masks in villages, but they are very few and far between.
So last question, Moushumi, Shobit is asking, what is the public sentiment now against the Yogi government? What are people saying about him? Do they feel that he has been able to handle the pandemic properly, or are they angry about the fact that there is very little happening?
There is anger, Jyoti, but you see, people are, so distressed at what is happening to them. I mean, so many of these people have their loved ones in the ICUs, in the hospital, that right now, they are not, they are not talking about what kind of work the government has done or not done. But of course, there is a lot of anger about how the whole situation has been handled, how there is no governance mechanism in place. You go to hospital beds are full, nobody is there to tell you where to take your, if somebody is serious, where should you go? If that hospital is full, there are no medicines. Patients' relatives are being told to, they are given letters and they are told that you go and get the medicines from outside. So no system in place. Nobody knows if somebody in a family is serious, there is no helpline in place. There are helpline numbers, but nobody picks up. So nobody knows what is happening. So among the general public, Jyoti, of course, there is a lot of anger about all this.
But we don't know if that anger is going to stay and how it's going to materialize. It sounds like Ram Bharose to me, Moushumi, that the people of
Uttar Pradesh, it's pretty chaotic, and it's pretty chaotic out here.
That the people have basically left it to their gods and to their goddesses, their private gods and goddesses. And
and I saw so many of these young people, 36-year-old, getting admitted to hospital on Monday, and by Wednesday he has passed away because he got admitted when the person was pretty serious. So many instances like this. I mean, it's really heartbreaking when you see what's happening around, and it's also heartbreaking and distressing when you see that nobody from the authority is there, to talk to the people, to talk about measures that is being taken.
Yeah. Absolutely, Moushumi. Thank you so much for your time, for answering all the questions from our viewers. Friends, you are watching iWitness. This is the Print's daily live feature covering the COVID pandemic. You've just heard Moushumi Das Gupta explaining the absolute grave situation in Eastern UP. She's just been in Gorakhpur and she's now in Allahabad. So please do continue to watch iWitness every day, this time around 5 p.m. Thank you so much, Moushumi, for your time, and stay safe, mask up wherever you go, and I'll be following you and coming back to you and asking you very soon about your next, about the next place that you